The mayor's Restart Cleveland plan is a series of actions, programs that were put together to deal with the suffering that is taking place, suffering among our citizens, the residents of the city of Cleveland, many who have lost jobs and therefore have lost income and are challenged to deliver and sustain the basic needs that they need for themselves and their households. The suffering of our small businesses who were directed to close their businesses, in many cases to just zero, and are now challenged to sustain their businesses. The plan also addresses the reopening of businesses as the goal to place small businesses in a better position to be successful as they reopen and hopefully and then also reemploying our residents. The plan develops the infrastructure to meet these immediate, ongoing, and future needs that our residents and small businesses have, and also to align this program with other additional resources. In terms of the speaking agenda today, we all have bits of that program that we'll be presenting to the council. So it sounds like a long lineup, but it won't be nearly that long. And we'll each be introducing the next speaker. But to run through that lineup, I will be introducing Assistant Director Mikhail Wackers, who will provide an overview of the grant and the eligibility for the funds that the city is receiving. The Assistant Director will introduce Director Maness, who will discuss the programs to address the basic needs of our residents. Director Maness will introduce Director Collier, who will be addressing the basic need of broadband and broadband connectivity to especially to the students in the Cleveland Metropolitan School District. Director Collier will introduce Director Ayanna Blue Donald, who will address the rental assistance program. Director Donald will reintroduce Assistant Director Mikhail Wackers, who will discuss the program and how it addresses homeless population in our city. Assistant Director Wackers will introduce Director Ebersol, who will discuss small business assistance. And then lastly, our health area. The state may be reopening, but the mayor's message is extremely clear, and that is that our residents and our businesses should be using extreme caution. The pandemic is not over. People are continuing to get ill. People are continuing to die. And as we reopen, it's important that the city outreach and continue to reach and educate our residents and businesses on the best practices to remain healthy. And Director Ebersol will be introducing, I see Director Gordon, is your chief on here someplace? I don't see her. So I'll be introducing either Chief Walker Minor, Director Gordon, or Commissioner Sosiak as well, and to further discuss the health component of this program. So without further ado, I'll introduce Assistant Director Wackers.
Thank you, Chief Ribka. And before we go to the Assistant Director, just a housekeeping note. Based on what's been publicly made available and the lineup that you have with us, there's going to be a tremendous amount of information on a tremendous amount of money, in my opinion. We don't have any executive summaries. I'm going to ask that we have some sort of written document forwarded to the council because this is we're all going to be taking notes as we go, but this is something where I want a reference document to have available. So if you could get that as soon as possible, I would greatly appreciate that. With that, Assistant Director.
Yeah, good afternoon, Council and members of the committee. So I'm giving you a broad overview of the CARES Act funding that the city has received notice that it is receiving. It is coming in 2 tranches, and we are aware of the amounts in the first tranche, and we hope to hear soon about further funding that's coming through the CARES Act. But the CARES Act was a legislation passed by Congress in March 26, 2020. It was a $2.2 trillion piece of legislation, but within that, the city received direct grants through its normal entitlement programs. So community development.
I'm sorry, Assistant Director. Councilman Plenzek, are you doing that on purpose to make us laugh? Wait, hang on. I'm sorry, please continue. You're upside down, Mike.
Okay.
Okay.
Right. Very interesting. So go back. So our entitlement grants that we receive every year, we receive community development block grant funding for investments to better improve low and moderate income households quality of life throughout the city of Cleveland, either through infrastructure, construction, small business assistance, public services, and a range of other type of programs. We received the pot of money under the CARES Act right now of 12.7 million. And then we have our second pot of emergency solutions grants, was deals directly with homelessness throughout the city of Cleveland. And we received a pot of funding of 6.4 million. And then HOPWA, which stands for Housing Opportunities for People with HIV/AIDS. And as the name implies, it's directly to help people with housing who have HIV/AIDS. And we received a small grant of 229,000 from that pot. Now this funding has been, we received notice in early April that the funding was forthcoming to the city of Cleveland. We are in the process, obviously, implementing the mayor's framework. Part of that implementation is to do an annual action plan amendment to HUD. And once they approve that, then the city will be able to enter into an agreement and have their line of credit increased in those grant dollar amounts. Just to give you so the CARES Act, in addition to either the flexibility or restrictions that are allowed under those three programs, the CARES Act implemented either some flexibilities or further restrictions in order how we can use the funds in the city of Cleveland. First and foremost is really specifically geared to addressing the needs that arise from the COVID-19 public health crisis and the associated impact on the economy. And that is to benefit or direct people, issues with businesses who have been shut down, or households of low moderate income who are now reduced income or have lost income as a result. For homeless activities we'll get into later, but it's really to prevent and prepare and respond to the coronavirus in order to make sure that at-risk population has the necessary activities in order to prevent and prepare and respond to the coronavirus. And then the same is true with HOPWA, housing with HIV/AIDS people. As part of the development of the framework, we've been using data that we are aware of. One of the easiest data points that we can collect is United Way's 211 call numbers. As a result of this public health crisis, we saw immediate need from a range of different types of activities. So from food delivery, which has been, I think, most prevalent on the news, but also unemployment insurance information people have been reaching out and trying to obtain, rental assistance payments, access to emergency shelters have gone up in requests, and along with other type of social service type of issues, and which we'll get into activities in the framework later on. With that, I just want to talk quickly about sort of the universe of households and people being impacted by the coronavirus, and why we've been directing our funding in certain ways. But we do know that low and moderate income households in the city of Cleveland total around 119,000 households. Of that, and that's around a family income of around $50,000 per year. Of that, there's a large section of Cleveland households who earn $25,000 per year or less, and that's around 59,000 households. And if you look at households with only one source of income, that's 73,000 households in the city of Cleveland. Why those numbers are important is that these are probably the most at risk. Once you lose your only source of income, or if you're at a very low income, any type of public health crisis or economic crisis really puts tremendous burden and pressure on these households. We also know that 64,000 households throughout the city of Cleveland are rent or housing burdened. So they're already paying more for housing than is typically determined to be appropriate. So they're paying over 30% of their income on housing. And then there's probably an estimated number of around 36,000 unemployed citizens of Cleveland as of the recent numbers that have been coming out of, and that'd be an increase from 11% that was in 2019 up to 23%. And put that in perspective, in 2010, sort of around the time of the Great Recession, Cleveland's unemployment number stood at 20%. So we are, all of this is sort of necessitating a targeted approach for investment in the CARES Act. And with that, talking about how we're going to target it, I'm going to hand it over to Director Manez, who's going to talk about the first sort of part of the framework we're here to brief you on today, which is basic needs.
Council President Kelly, can you please admit Director Maness back in the meeting? She got kicked out.
Yes.
Thank you.
Let me find her. For the record, I didn't kick her out. It was a technical thing. Director, are you with us? Hang on one sec. Let me unmute you. Give me a minute here. Director, are you muted on your end? Because I'm trying to.
I'm not now. Sorry.
Okay.
I was busy trying not to be disruptive and then was incredibly so. So was Assistant Director.
That wasn't my fault, but go on.
I'm happy to take full responsibility. Is Assistant Director Wackers complete with his comments? Yeah, okay, so I had difficult timing too. Sorry about that. Okay, so I was going to talk for a moment about basic needs. So as we were researching the needs of the community after, actually prior to April 7th, and then in the few weeks as we put this program together, it was very clear by looking at the 211 data from United Way and from hearing from our partners in the community that the basic needs were what our residents needed, that they were struggling with food delivery, with utility assistance, and that before we could look at restoring or rebuilding the economy, we really needed to be responsive to those needs. And I think that's been apparent to all of us over the last several months. So we are planning to use $4.25 million of the CARES Act money to meet those basic needs. And we'd be working with city staff, with our community engagement healthy home specialists that have been deployed in the field, and then with our partner agencies, with nonprofit partners and community development corporations to deliver these services. We will really be looking through an RFP process for our partners to be people who can deliver the services right away, that they have extensive experience delivering exact or similar services. They may already be doing so with, for example, the COVID-19 funds from the funding community or others. So they're ramped up, and they would be able to provide the service for some amount of time until the city could reimburse them. And then finally, we're really going to encourage the services to be provided in collaboration. We know that our partners won't have very much time to respond to an RFP, but where possible within neighborhoods or across services where there is an opportunity to collaborate to reduce the amount of contracts and the amount of overhead of the work, we're really going to encourage that. The basic services that, again, we're going to outreach for, as I mentioned, are food, delivery of food and toiletries and other, significant services that residents who can't go out can access, emergency utility assistance, senior services that we'll be partnering with the Department of Aging on evaluating, homelessness outreach. So beyond the direct service to house our homeless, but also to outreach to people who might be becoming homeless to ensure that we try to keep them out of the homeless system. And then finally, referral services. And this is really, again, building on the the community engagement, healthy home initiative, and the CDC infrastructure that exists today, not just to refer residents to services, but really to connect our residents with the services provided by the CARES Act, to connect residents with additional county, state, and nonprofit services that might be able to help them fill out applications, whether it's something that the city's providing or the county or unemployment insurance. It's really to help connect those dots and ensure that the process to get help and support doesn't actually get in the way of people doing so. And that's a really significant part of the basic needs piece, is to really make sure that people are aware of the services out there and able to access them. So I think that's, the main package there. And now I'm going to hand it over to Director Collier to talk about the broadband services.
Okay, thank you, Director.
Thank you, Director Maness. Can everyone hear me?
Yes.
One of the things that COVID-19 obviously has exposed is the chasm with respect to technology. This is something that has been a point of discussion and need for some time in our community. But given the fact that COVID-19 has increased this exposure, part of the CARES Act funding is going to be focused on broadband access, specifically meeting the needs of our 37,000 CMSD scholars who actually need access, who come from low-income families, and who are engaged now in distance learning. Many of these families do not have high-speed internet. The CMSD has invested resources to the tune of $2.4 million to address this access issue in the near term. We are working in conjunction with CMSD and local nonprofit Digital C on a longer term solution. The first phase of that longer term solution is an investment of $500,000. And the goal is to reach 1,000 CMSD students. This will do three things. So the funds will be used for backbone infrastructure to support the households. It'll also go to providing household equipment or devices that are attached to the various units that are identified, and also providing PCs and other devices internally to those students so that those students can have access to complete their academic year. And this is something that's a important priority that we all know. And these resources will go to be leveraged in that way. Now, obviously, the need is even greater. And this is something that the city, CMSD, and other partners are continuing to fundraise around. It is our hope that the next round of resources goes toward continuing to scale that effort up, because we know that broadband access is a huge gap right now in our city. At this time, I'm going to turn it over to Director Donnell. She's going to talk to you about rental assistance.
Okay, thank you, Director. Director Donnell.
Good afternoon, Council President, Councilman, Council Lady. So for the rental assistance program, I mean, there are a lot of factors to think about, just in the sense of our community has been asking or thinking about this for quite some time, even without the presence of COVID and the pandemic that we're in. But if you look at just the makeup of our residents here in Cleveland, there are about 119,000 households with less than $50,000 in income. And that statistic is important. When we looked at designing the program, we really aim to focus the $11.3 million, the funding that will go towards the rental assistance at the 80% AMI. So when I mentioned the $50,000 household income, that's 80% AMI. So the programs that we have devised, there are three essentially, but they all target COVID-related tenants. People that have had an impact on their income are either unemployed or their household income has decreased since about March 1st, and looking at that 80% AMI as a figure. So of course, if you make less than that, you should be covered. So we are making sure, and as Director Maness explained earlier, is really important to make sure that we, as RFPs are going out, have someone that can take charge of this program that has the capability to do it in a fast way. Housing Court, of course, as of right now, will restart evictions on June 15th. So we are feverishly, essentially working towards that goal. We are working with our community partners and reform organizations such as Housing Court and Legal Aid and Cleveland Mediation Center, because referrals over to this program is going to be very important. A lot of these organizations will see these people more often than just walking into City Hall or walking into the organizations that will service it. We are looking at, of course, there will be a capped benefit for the rental census that is provided. We will look at the fair market rent or the lease amount, whichever is less than 30% of the household income. And then depending on which program or where you qualify for, your assistance can be from 1 month up and through a 12-month period. Of course, the guidelines get a little bit more stricter as the funding goes out longer in time, but there is a continuum here. Of course, to just try to prevent people from losing their home or losing wherever they are living. As we go through this, there will be, of course, income guidelines and just verifications that the tenant will have. Of course, the landlord as well with rental assistance. I'm sure some people have questions just about, well, landlords, what will be required from them? The payment will go to the landlord. Of course, it will not go to the tenant. So there will be some requirements that the landlord will have to submit as well. But of course, we don't want to displace a tenant just because a landlord is not necessarily as compliant as we would, because this program is mainly for the tenants to keep their home and to not become homeless. General overview of the program. Next, I will pass it on to McKeel, and he will discuss our homeless projects and initiatives.
Yep, thank you, Director Donald. So this next section focuses specifically on the city of Cleveland and Cuyahoga County's continuum of care. We partner in order to provide funding that support our homeless initiatives throughout the county. And we are setting aside a portion of the CARES Act funding in order to meet the increased costs in order to maintain that system. So the funding we've allocated is $2.5 million. And what we do know is that as a result of the stay-at-home orders and the requirements for social distancing, our shelters have been required to deconcentrate. So we're still trying to serve the same number of people, but we can't serve that same number of people at our facilities that currently exist. Therefore, the system, the continuum of care, has had to rent out hotel rooms and motel rooms in order to provide these homeless clients housing in the interim. This comes at a significant cost each week. We are also using those hotel rooms as an opportunity to prevent potentially or at-risk people with the coronavirus from entering into our shelter system. One of the reasons we do this is that if you disclose yourself as being homeless at a hospital, after you're discharged from the hospital, you typically go directly to the shelter. Well, we're trying to divert those people who are coming into the shelter from the hospitals and put them directly into a more quarantined environment in the hotel room so that they don't interact with the general homeless population. We're also seeing increased sanitation costs as a result of the need to prevent transmission. And that's largely coming in the cleaning our facilities, but also renting of portalets in order to ensure that there's adequate sanitation with all that, all the infrastructure we have. And then the third big cost increase is that all staff at these facilities are now earning hazard pay. That's a 20% increase over the normal pay. And that's going to continue at least until the state really starts to roll back these stay-at-home orders. But that is a cost that is ongoing and was not planned for as a result of our normal budgeting at the beginning of the grant year. With that, I am going to hand this over to Director David Eversole, and he's going to brief you on the Small Business Assistance Program.
Thank you, Assistant Director. Director Ebersol?
Thank you. All right. Again, thank you everybody today for taking the time and having us here. We're looking at 3 different programs through this tranche of funding to help assist our small businesses. The central premise that we're operating from is that small businesses, especially our storefront neighborhood type businesses, all have overhead. They all have fixed costs. A lot of the federal programming that came down even for those businesses who are able to access it was focused predominantly on payroll. Payroll is a big part of your business, but it's not the only part. You still have to pay rent, you still have to pay utilities, you still have to pay for inventory. And so we wanted to provide a vehicle in which we could provide these businesses with working capital today to help them deal with the costs that they're going to face. And then we would be paid back post-pandemic over a long favorable term, so as that we're not putting an undue burden on people having to pay us back. So the first program, which we rolled out a few weeks ago, is the Emergency Working Capital Loan Fund. Quickly realized that we were going to be oversubscribed to that. So as we started working on this program, we thought we'd add some additional funds here from this program. That program provides $10,000 loans for small businesses. The second program that we will be rolling out is the same type of program, but focused on those businesses that we found pretty quickly were bearing the heaviest burden of the closure rates of the stay-at-home orders. And those are businesses like restaurants, those are businesses like personal care businesses, those are your storefront retail businesses that not only were among the first to be closed and were absolutely shut down, but then as they are now starting to think about reopening, they're going to have to do some real accommodations in how they're going to be working and running their business in the medium term, short term, medium term, as a result of the pandemic and social distancing and everything that we're going to have to do. And so the program targeted to them would provide them with an additional $20,000 in working capital loan, of which half could be forgiven to reflect investment made in that personal protective equipment, masks, gloves, all those things that people are going to be needing to buy, enhanced cleaning supplies, and then things you don't necessarily think about, things like air filtration systems and the like that we're hearing the businesses are going to be installing. So trying to help relieve some of that burden for those businesses as they try to get started up. And then our third program that we're going to be rolling out is a broader working capital program based on what you call larger small businesses. So there's a couple of different tiers of business, but that focus is a little bit away from the service sector and into our production sector as well, with the understanding, looking at the lessons that we learned from the last recession, looking at some of the things that we've seen. You saw the big issue recently with meat packing. You could see that in other industries as well, as you start to have something flare up in one segment of the economy, and it can reverberate out throughout other sectors, and then that can put a strain on businesses as they lose supply, as they start seeing their accounts receivable go up. And so we're again trying to provide these businesses with some capital that will stretch out and help them get through where they are today and into the future when the economy gets back on its feet. So those are the 3 programs that we are planning on rolling out. We're using a mix of leveraging some of our resources, the city's resources, some of the CARES Act Block Grant Fund, and some money that we're going to be borrowing from the federal government with the HUD 108 loan. All of those programs together will blend real well into providing $10 plus million to go into our small business economy and trying to help keep those businesses alive through what's going to be another tough couple of months at least. So those are the focuses we've got for small business support. With that, I'll transition over to Chief Walker Minor, Director Gordon, and the team from Public Health.
Before we do that, Director Blue Donald, do you have a question? Is your hand up for this, for Director Ebersol, or to add something to this, or is this left over? Very good. Okay, so we're gonna go to Chief Walker Minor.
I'm here with Merrill and Persis. Yes. I'm sorry. I was reading something, so I didn't hear the last part of what David said.
You're up.
You broke up, Council President.
I'm sorry. Director Ebersol concluded with the next.
Okay, and so what I want to do is I want to turn it over to Merrill and Persis to talk about our Hopway grants. I'm in public auditorium, so the connection is not strong here. Merrill.
Great. Hi, everyone. Good morning, Mr. Chairman, members of the committee. I'm really pleased today to share with you that there were additional dollars through the CARES Act for the housing opportunities for people with AIDS. That's the HOPWA dollars, and additional funding for prevention work in the Community Development Block Grant funds. We've presented to you many times on these. I believe that we've received these dollars for at least 23 years, maybe now. And we're realizing that there's a tremendous demand for these resources right now. Certainly, individuals who are HIV positive or with AIDS are considered in vulnerable populations as their immune systems are compromised and are at greater risk for this COVID virus. So what we did was look at all of the demands on our programs and sort of looked at where the best use for these funds were for the community, and saw that rental assistance and utility assistance were very high. So this will help to reduce homelessness and assist people in maintaining the services within their rental units and with rent. Additionally, there's some funding in there for food and nutrition, which will include no contact home delivery every 10 days and some PPE for both clients and members of the staff of the two agencies that receive, or the three agencies that receive these funds. That would be the AIDS Task Force of Greater Cleveland, Eden. It's also including some permanent supportive housing placement. So this helps with the first month's rent and deposit for those individuals. And additionally, some support for nutrition and for food. Under CDBG, the third agency is Nueva Luz. There are three agencies under HOPWA, AIDS Task Force, Eden, and Nueva Luz. Under CDBG, we have three contracts with those agencies as well. Circle Health, it used to be called the Free Clinic of Greater Cleveland. There is additional funding in there for education, counseling, and support, which are in huge demand right now in the community. Additionally, the Center for Community Solutions, that's housed the AIDS Funding Collaborative, is working at building additional capacity and coordinating of services in the community. So we're really quite grateful to their leadership in that work. And additionally, NEON is our third agency that we contract with under CDBG. We have had some requests from some additional agencies to see if it would be possible to be part of all of this work. So we are working with them to see if they could perhaps be a sub-agency under one of our currently contracted agencies, either in CDBG or HOPWA. But these are really critical dollars in this time of need, as you know. And so we're just really grateful to have additional funding in this area, especially for these individuals who are really challenged during this time, especially because of their they're already under compromise or their compromised health condition. So that's what I have for these two programs. Happy to answer any questions when we get to that.
Okay. Thank you. Is there anything further from Department of Health? Is Commissioner Sosiak with us, or are we ready to surely continue on? Anybody? Director Rib or Chief Ribka, have we got?
Yeah, I thought there might be an opportunity for a brief overview of the outreach effort that is going to be undertaken by under the health cluster relative to education and outreach. Chief Walker Minor.
Sure, I can chime in on that. Actually, the reason why I'm over at, can you all hear me? Because I think there are a couple
Yes.
firewalls at Public Hall. Okay, so I'm actually over at Public Auditorium because today was the first of 2 days where we are training just under 100 City of Cleveland employees who have been deemed up until now non-essential, as essentially an army of employees that will begin going out on Wednesday of this week with a prevention, education, outreach campaign around for COVID-19. Essentially, they are going to carry the message that we have heard consistently in terms of wash your hands, 6 feet social distancing, and all of those things to eliminate mass gatherings in effort to make sure that Clevelanders are healthy. This is a part of and a strategy for the 2 areas in the Cleveland Restart that Mayor Jackson announced a week or so ago. And those 2 areas are the health of Clevelanders and the health of our businesses. And when he spoke with us about how do we reach Clevelanders with an overwhelming message, I had a couple conversations with Meryl Persis and Jason Wood, and just from my days in public housing, I knew that outreach workers is a human touch point to get to people messaging. So we worked with HR, of course, that's in my portfolio as well, talked to the unions, and we were able to identify, as I indicated prior, just under 100 people that are being trained today and tomorrow to go out into the community and to spread the messaging around how to be safe and healthy during this coronavirus. And I'll take any questions that any of you may have.
Okay. Thank you, Chief. Chief Ripka, is that and others, is that all of our presenters for the day?
Mr. President, yes, that concludes our presentation.
Okay, I've got a couple questions to start, and if others could raise their hand as appropriate, if you've got a question. My overarching questions are, first of all, I'd like to know, once we get the written material on all of these different initiatives, how does an affected person access this money? How does it go from this idea into somebody's account so that they can avert eviction, or a business can use it to keep their to keep paying utilities so that they don't get evicted from the business, they can take care of overhead. So I'm not sure who would like to take a first crack at this, but I would say specifically what I've heard the most of is for the business assistance, including rent and utilities, and for the the $11.3 million for rental assistance. I think of all of the concerns, I would actually go in reverse order. Rental assistance is the biggest concern I've heard, followed by business assistance as well. So if anyone would like to just address those broadly, and then I've got a couple specific questions.
So, Council President, this is Tanya Maness. I can just sort of broadly speak to how we will be able to begin to use these dollars, and then Director Ebersol might want to speak specifically to the business side. So we did mention, Director Donald and I, about RFPs that are drafted and have really been informed by some of our partners in terms of how they could best respond and deploy the funds, especially with rental assistance, because this is a new program. We expect to be able to have partners in place by mid-June, and in doing that, have programs ready to deploy by July 1st. Now, I know that seems like a very long time from now, but there are two things that I think help with that. The first is that the CARES Act funds can go towards reimbursing for work that has been done, basically from March 26th on. As well, we know our partners out in the field today are supporting our residents, whether it's through the COVID-19 funds that have come through the foundations or others. They are already doing some of this work and are taking names as well as collecting information about residents who may need support so that we can have a queue of people. I've also been working with 311 so that we'll have places, whether it's community development, or again, there are just a few partner agencies that can do rental assistance, or just calling into the Department of Community Development. So we're aware of who needs this support and how to work with them as soon as it comes online.
Okay, but if I can, if you could answer this question. You talked a lot about partners and dates. Like, I don't know what that means. Do you mean that we're going to do an RFP so that one of our, and there's only a handful of our housing agencies are going to be contracted to be to write the checks to get this money out the door? And who's running point on this? So who do we refer people to? There's a lot of need right now, especially when May 1st came along and when June 1st comes along. Who's running point on this, and how do we best direct people that are anxious about these programs?
Sure, and I think you put the nail on the head, Council President Kelly. From a rental assistance perspective, there really are just a couple agencies that are ready and able to do this work. The program will be deployed through community development. We know that there are referrals that are coming in already now through legal aid, through the mediation center, through housing court, but people should be referred either to community development, or they could be referred right now to CHN Housing Partners or to Eden, because they're already getting inquiries.
Will you, when the written documents are provided to us later today, will you provide a contact number, like a clearinghouse, just some kind of point of contact that people can use for the rental assistance program?
Yes.
That's what's unclear to me, and I think it's unclear to a lot of people in the community. So that would be most helpful.
Yeah, Council President, I will, in that I think, we need to ensure that calls are coming in through community development. I think we have to be clear in terms of setting expectations, though, that funds will not be ready to be deployed that quickly. But we will start taking phone calls so that we can have people's information.
Okay, I just think it's very important that somebody who is in a position where they're facing eviction, meets the criteria, is at least guided through the process, that this is what it looks like, so that they can probably have a conversation with their landlord or do some other entity that is that they're responsible to. So if you could provide us with all the points of contact for that, I would appreciate it. And similarly with the business assistance, Director Ebersol, I've been calling you directly. I'm sure that is going to be not workable for every claim that we have. What is the process by which, what's the portal by which a business that needs assistance, how do they operate? So if you.
Okay. Couple things. So I think everybody on my staff is at least familiar with the program, that we can walk people through the application process. We've had an application out for a few weeks now that we've been taking in. We've had 275 or so applications that we've already kind of got loaded up, that we've got the information on. And so I'm fortunate compared to my colleagues that I'm a little bit, we were able to get ahead of it because we had other resources besides block grants. So so we've got a system in place that I think we're doing a pretty good job. I've been getting referrals. I've been getting, I've seen my staff getting referrals. And so I think we've got some comfort level there, at least on the first round of programming. And then we'll be building out the applications for the next couple rounds of programs, predominantly the same. I think we've managed to do some program design, so we're going to avoid some of the pitfalls and trips and traps, but there's going to be some, to borrow a phrase from Director Collier, building an airplane as you're flying it, going on as we try to bring the system on to do the volume of work that we're going to do. So short answer is anybody in my department can help get a business tracked around and can get a response, even if they don't have the answer, can get a response back in a day or two on what we need to do and how we can do it.
Great. And a similar request that I made to Director Maness, you've been very responsive, your staff's been very responsive in trying to get this money out the door, and I appreciate that. But some process by which we can refer businesses to, so they can, have a sense that, yes, my application's been received. It's in process. On this question, we need a little more information. Somebody that can just hold hands of the businesses that,
Sure.
Small businesses don't have complicated accounting systems or detailed financial statements. So just somebody that can help work them through the application.
Okay.
Would be appreciated. And then Councilman Zonan, do you have something on that point?
No, I'll wait.
Okay. And then I want to go to just a question on when we're talking about the staff members that are going to be out messaging and doing things. I guess this would be to Chief Walker Minor. Are they going to be the actual contact tracers, or are they more just trying to promote the community health agenda that we have set forth?
Or they will not be contact tracers. That is completely different.
Okay.
We have other staff persons in the health department that have been trained as contact tracers. We may, in fact, and probably will expand the number of contact tracers, but these employees will not be contact tracers. They are community outreach workers.
Great. Okay, thank you. Okay, I have spoken enough. I see Councilman Kerry McCormick has his hand up. So I will now go to Councilman Kerry McCormick for questions.
Thank you, Mr. Chairman. And please let me know if you can hear me or not. But I just got first of all, I want to thank you, Council President Kelly, for putting together this committee, and for our clerk staff, Vakita and Pat and everybody else for putting this together. I really appreciate it. As we all come to folks from our living rooms or home offices. So appreciate that. As well as the administration officials who have been really working hard to, come together on this pandemic, as well as figuring out, quickly, whether it's small business relief or public health. So whoever's in that background, mute yourself, please, so I can hear. Everybody should mute yourself if you're not talking.
If you're not on, right?
We've become Zoom aficionados these past couple months. Anyways, really quickly, so I've got two questions, Mr. President. One on the health side, and I wonder if Director Gordon or Chief Walker Minor can speak to testing for people that find themselves at homelessness. So is that being spearheaded by the county? I've heard that Metro Health is participating in that. So could you a little bit of overview of how our homeless community is being tested or plans to be?
Sure, Toya and Meryl and can chime in. Metro Health, Dr. Jennifer Alexander, have been working diligently with a screening process. So literally, Metro Health went into each of the shelters and into each of the hotels that have been supported as a way to decrease census and conducted screenings. They are not conducting testing, but they have been conducting screenings. And that has been going on now for at least 3 weeks, maybe 4 weeks of screening is occurring, unless someone presents and at a hospital and the physicians there then determine that that person should be tested.
Hi, thanks. This is Meryl. So, right, exactly what Natoya said. Additionally, there will be there is some actual testing of some individuals if they are symptomatic. We're working with the Office of Human Services to put together a much more robust plan about testing in these congregant living facilities, basing it on risk factors of kind of what the physical plant is, how people, if they sleep in separate rooms, what are the bathroom situations, how much is actually, how much people come in contact with one another. They've really done a tremendous job at reducing the number of people at each one of these facilities to make sure that they could reduce the risk as much as possible. Metro Health has been the primary partner with this work. We're also bringing in all the FQHCs to see how they can help and assist with this work. There are, I believe, 5 hotels that have come on board to house individuals who are either symptomatic or who have tested positive, if they don't need to be hospitalized or if they need to be discharged from a hospital. This work kind of continues. We're also looking at all these categories of congregant living facilities, whether these are sober houses or kind of any type of housing facility. We call that, there's a term called congregant living facility. It's where people live together without sort of their own, perhaps entirely their own 1-bedroom unit with their own bathroom, etc. So this work that's kind of being done right now with the help of a lot of social service agencies that support the Office of Homeless Services and support this population. So we're hoping that this more robust plan to test and screen. So again, testing is for testing for COVID-19, and screening is to do general health assessments of temperature, symptoms, checking for some of the symptoms that are prevalent with individuals who are positive with COVID-19 or flu-like symptoms. And checking in with them regularly.
Thank you, Director, and thank you to all your staff. I know you guys are working 24/7, so appreciate that. Mr. President, question 2 for 2 would go to Chief Ripka, Director Ebersol, and Director Collier. And this is per an email I sent earlier, or actually last week. A lot of cities across the US are shutting down temporarily some of their streets to allow for more seating capacity for local restaurants that is socially distant and safe for patrons. I sent an email out last week requesting whether that we could take a look at that from the administration's perspective. So can we look at the possibility of, throughout the city of Cleveland, taking back some public right-of-way to support our local small businesses and restaurants in our commercial districts?
Chief Ripka, you're muted. There you go.
Am I good? Okay. I was just going to say quickly, and I'll have Director Donald, Director Collier follow up, but it is an issue that is being looked at. It's not an easy snap of the finger thing, but it's being looked at by the various departments that would be involved in making a decision that would go in that kind of a direction. Director Donald, Collier, if you have something to add there.
Sure. Thank you, Councilman McCormick, for that. Because with respect to the need to social distance and the fact that the temperature is going to be heating up soon, and this reopening of certain businesses, you're going to have a need for capacity. And the fact that other cities are looking at their right-of-ways as a prospect is something that, again, has been exacerbated or accelerated because of COVID-19. But like in your neck of the woods over there on Market Street, this is something that we've all have discussed previously. So this kind of puts an accelerant on that. So we have started the process of beginning to evaluate where this could be done, what makes sense. To Chief Rivka's point, it's not a snap of the finger. When you start to look at opening up the right-of-ways in districts where you have multiple venues, that can lead to a lot of volume of folks. And that has to be managed in order to make sure that, you know, tables and things are set up and everything is done the right way. But to Chief Rivka's point, we are looking at that. But like we do with everything in this administration, we want to do it carefully and thoughtfully.
Anything
Thank you. I was just going to say, please keep me updated in those conversations. I'd like to be a part of them. That's all, Mr. President. Thank you.
Right. Thank you very much. Just a little technical issue. I guess I'm not seeing all the hands that are going up. So on my list so far, I have Councilman Zone, Brancatelli, Griffin, Plenzik, Casey, and Joe Jones. And I think that's the order. And if you don't see a little blue hand on your screen, if you would just shoot me a quick text, I would appreciate it. So with that, I'm going to go to Councilman Matt Zone.
Thank you, Mr. Chairman. First of all, thank you for convening this meeting. It's good to see so many wonderful faces. We've all been cooped up, and so I appreciate this opportunity. I'm going to continue with another question related to what Councilman McCormick brought up, and then I have a number of other questions. We also should get our law department engaged in this conversation around opening streets. State liquor licenses are tied to parcel specifics and premises, and having liquor move into our public right-of-way. I don't know if we need any relief from the state, but that's something that we should look at. I appreciate Director Collier saying carefully and cautiously. You know, constituents interpret that to being slow and deliberative. And so businesses need help. And so we need to get on this like ASAP and see what we can do immediately to not violate any of the state liquor licenses that are in place. But I'm also very interested. There's a number of requests I've received from business owners, and I would be very interested in seeing what we could do to open up some streets. So I'll just leave that there and just know that the administration is going to gauge our law department as well in this process. Mr. Chairman, my first question is for Director Ebersol related to Emergency Working Capital Fund. So today you said 275 applications have come in. We know we initially seeded that with the $1 million, assuming, you know, 100 people get it, that's $1 million. And so what happens to the other 175? Are we going to replenish that fund? Can you speak specifically to the working capital fund?
Yeah, thanks, Councilman. So part of the $10.5 million that we outlined today includes taking that from $1 million up to $3 million that we're anticipating right now. And we'll, you know, we have those resources are to some extent fungible. So if we find out that we're oversubscribed in one program and undersubscribed in another, we can shift that around pretty easily. So pretty quickly realized we were going to have to make and choose, or we're going to have to find more money, and we went in that direction.
Great. And Director, can you, for those who are watching, because I know I've had a number of small businesses reach out to me, I've encouraged people to tune into this briefing session on YouTube. Can you speak for those businesses that have submitted an application ready to your office? What's the process? What's going to happen next? When may they hear from your department?
Sure. We've been reviewing these applications pretty rigorously, generally about a 2-week turnaround from what I've seen and how we've been able to kind of review, do the underwriting, get the information we need, and move things forward. And so we're right now figuring out how we're going to get this money in and what the timing of that's going to be, so that when we communicate out to people, we can give them a more robust timeline of who's going to get money when and how fast it's going to turn around. We're doing some things on the back end as far as working with the law department on coming up with some templates, quick contracts, ways we can shorten up the process so that we can get this money to people as quickly as possible. So, anyone is welcome to follow up on their application if they haven't received communications. Most people should have received a communication saying either that we have what we need, that we're doing our review, or that we're still waiting for something, and that follow up along those lines. And then I would hope to be making some communications to the affected businesses in the next week or this week or next week as to, okay, you're approved, here's how this is all going to work, or you're going to, you're something was missing, and here's how we can correct that.
Thank you. Through the chair to the Director Ebersol. So you're saying that within the next week, those who have submitted applications should hear something back from your office, whether or not they were approved, and kind of next steps associated with this. Is that accurate?
Yeah, we'll communicate back in the next week or two, everybody what the next step is in the process.
Okay, and then just following up on that, I know that you briefly talked about 2 new programs that, and I know the mayor announced. Do businesses, I've had just in Ward 15, 27 businesses, by the way, Director Ebersol, your office, my office, we sent in a support letter almost in real time. We're getting a communication back the same day acknowledging receipt of that. So I appreciate the confirmation on your end. With respect to those new programs, do businesses need to send in additional applications as well for those? Can you speak to that, please?
Sure. So we're going to be building up that infrastructure over the next few weeks on how we're going to do that. So I can't give you a clear, direct answer on how that's going to work out. But if you look at what we did with the emergency program, it was basically what the application that we normally use shortened to make it more simple and straightforward. My inclination is for the second tranche of the emergency program focused on restaurants and retails to do that as a, basically you'll do it, everybody who's eligible will get a supplemental. So we'll have some additional questions that we're going to do, but I don't want to force people to go, fill out a duplicative paperwork. On the other side, that program is pretty akin to what we're doing with our existing EDA working capital program. So we'll probably do the same thing with that. We'll take the application, we may pare out some pieces and parts that we don't have to, or add something that's more appropriate to the current times. But that's the plan for that program.
Okay, great. Got Mr. Chairman, just a couple more questions and I'll be done. These are, I'll start, I guess, maybe the health department. I received a number of inquiries from residents who feel that they might have contracted the disease. They're asymptomatic, but they showed some signs, and they want to know when will there be widespread testing for people who live in the city of Cleveland. Any insight, what we're gleaning from Governor DeWine's press conferences, or in the mayor's, I think we're up to 62 or 63 press releases now about it. There's never been anything in there that speaks to that. Can somebody speak to when testing might be available for individuals in the city of Cleveland?
Hi, Councilman, this is Meryl Gordon. Testing has been very, very limited across this nation and across this world. So really kind of identifying when it'll be available just for the city of Cleveland is kind of, we're unable to do that. What is coming online, if people are always able to call their healthcare provider, and if they are symptomatic, they have been able to be prescribed a test. We know that right now, Rite Aid is also providing testing at some facilities. The closest one to us here is Parma. And they can look that up. It's easily available on their website. But just to have testing available, these kits are really coveted. We are using them based on the Ohio Department of Health testing protocols that are all available. But it is really, we're trying to make sure that we are deploying those resources to facilities and people who most need it. We are also, and not to say that everybody doesn't, that's not the case, but that is why there's so much discussion around probables. Often, and we have started to include probables in our numbers as well, is if they have been in close contact with a confirmed and have symptoms. Not everybody has the same symptoms. Not everybody experiences this virus the same way, just like the flu or any other. But we do encourage those people to self-quarantine for the required amount of time to make sure that they, should they be symptomatic or be infectious, that they are not infecting others. But in terms of just massive availability, that is something that I think that manufacturers are trying to keep up with the demand as well. But we do, if you check with your healthcare provider, check with your doctor. And also, as we said, right now, it is Rite Aid, and I'm not advertising for Rite Aid, but they're the only ones who are doing it. And we believe that there'll be a fair amount of others that are going to be coming online very shortly. This is a self-administered swab. You do need to actually call ahead. You do need to make sure that that is prescribed, but that is available.
Councilman?
Thank you, Director. Thank you, Mr. Chairman. And I have been telling people, my staff has been advising them basically what you have said. We're all aware that there isn't enough tests available to actually have people take it, but it would be good to see if Rite Aid would consider some location in the city of Cleveland to administer these tests. I think they're doing 250 every time that they announce this. And I don't know if we could have somebody who could reach out to corporate Rite Aid from the administration saying that we'd like to see some of these tests done. There's one east side location and one in the city of Parma on the south side, but none in the city of Cleveland. So I'll just leave that there. Other question related, and I don't know if this is for Chief Natoya Walker-Minor or Ripka or Director Gordon. I've received several inquiries about hand washing stations connected with our homeless brothers and sisters. What are we doing along that front and making facilities available in a public space for them to do this activity? That's a question for anyone in the administration.
Director?
So,
I don't see her on the call. She must have dropped off.
I know that Chief Walker-Minor and Chief Brown were very, they were very involved with this. So I believe that there are 10 hand washing stations. There's a latrine and a sink that's provided at various locations throughout the city. We can get you where those are if that is that's necessary. But that was something that was done a number of weeks ago intentionally to make sure that these were facilities for the unsheltered who needed to have access to toilet facilities and hand washing. So they are hooked up. There is a water component to this, not just the gel.
Okay. Thank you, Director. Last question, Mr. Chairman. I appreciate it, Director Gordon, if you could email all the council members where those locations are, so when our offices receive those calls, we can direct them to the closest location.
Yeah, again.
If I can have Councilman just ask his next question, I would appreciate it.
Thank you. Last question. And I'm not sure, I've received some inquiries. I've already run this by Director Mike McGrath, but In the event, in the rare instance that some of our first responders, particularly EMS individuals, would love to be, other cities are providing housing for them so they don't have to go home during these next crucial months. I don't know if I necessarily need an answer or response there. I just want everyone in the administration. I've made the request over a week ago through Safety Director Mike McGrath. I would like people in the administration to talk about it and see if there's an opportunity for our first responders, particularly EMS, as they're going and responding to calls for people who might be sick with this disease, that they have the ability to have a place to go, a hotel room. I know we have a relationship with one of the downtown hotels, and I'd love to continue this conversation offline, and maybe I'll follow up with Chief Ritka, Mr. Chairman, if that's okay.
Yes, thank you. Councilman Tony Brancatelli. I'm gonna unmute you here. Okay, Tony.
Thank you, Mr. President, and certainly thank you for putting this meeting together. A couple of quick questions. Director Donald had mentioned on the fair market rents or the lease amounts, whichever is the lower amount for the rental assistance, just trying to clarify, because some of our east side neighborhoods, the fair market rent has been a challenge for folks who are doing subsidized housing and trying to establish that market. Sometimes it's extremely low for the market. How is that being determined?
And maybe McKeel can assist with this, because essentially it's determined by a program that takes an aggregate amount in an area of what the fair market rent is in that area. Correct, McKeel?
Yeah, HUD comes out with fair market rents by metropolitan area. And for our programs, we're following the regulations. So fair market rent is one component data point. Obviously the lease is another data point. And then there's another option where you have reasonable rent, where you do an analysis on a something smaller than a metropolitan area. And then you can come up with a third data point. We know that our partners do all three of these things, and we're looking just to really mimic sort of the accepted practice for rental assistance programs.
So is there an opportunity that we just want to make sure that we have a lot of affordable housing on the east side, and we're trying not to undervalue it, just so as long as there's an opportunity for folks to really not challenge, but to help determine, as we do with our housing vouchers, what the fair market value is, so that people aren't having a gap in that, because that gap would cause an eviction. If that person can't pay the rent amount and there's a gap in there and they can't pay it, then that means an eviction is going to go forward. If the rent's $500 or $600 and they determine that fair market rent is $400, that person's going to face eviction.
Certainly with what you're speaking to, there is some flexibility to try and address that. But again, it sort of falls into the three data points that I discussed.
Yeah, I would hope that we have the flexibility, since these are our resources, and we don't have to abide by the HUD guidelines. If it's reasonable, we should be able to be that flexible. And I just wanted to comment quickly with Director Maness talked about, as we're going out to find providers. We have been in this market for a long time through the PRC program through the county, and they've been administering this program. Are those, and you mentioned that those are some of the partners that we're looking at working through, whether it's Cleveland Housing Network or Housing Partners, Edens, et cetera. So is that, looks like that those are who our direct awards are going to be through, and they're going to administer?
So, Councilman, we will go through the RFP process, but our first criteria is that it is agencies that are ready to go with minimal infrastructure. And we are fortunate that we do have providers who are doing this work today and are working with the continuum of care and coordinating with the county.
Great. I mean, it's, being able to capitalize on those partnerships. And I understand that you are, looking at grading these applications with those who are doing a stronger partnership with neighboring communities. And so that's a wonderful opportunity there. I wanted to touch briefly on Director Collier talked about the digital divide and how important it is in bridging that. One of the concerns I raise is, and I certainly appreciate our engagement with CMSD, but there's thousands of students that don't attend CMSD schools. What are we doing to help provide for those services? As you know, in my neighborhood, they closed a number of CMSD schools. So we don't have a high school. We don't have, I mean, it's so being able to do outreach to those students, such as Cleveland Central Catholic and others that are providing high need students as well.
Thank you, Councilman. As I indicated previously, the need is always bigger than the capacity to handle it. And the only thing that we are doing and can do is continue to move forward in a upward trajectory to address the need broadly. Part of that is the issue of infrastructure. Our calculus with respect to infrastructure has to be one that includes broadband services. And this proposition that we're putting forth with the mayor's strategy here is addressing the CMSD space now, immediately. They have been engaged for some time with trying to provide digital infrastructure. We see this as an immediate opportunity to help stop the bleeding and also continue to move us along a trajectory of being able to provide wider access to the greater Cleveland community. If you want to look at it from a large scale citywide lens, there's 47,000 households, according to Digital C, that does not have access. That's a bigger conversation, a bigger narrative. And that's something that everyone is acknowledging. And keep in mind, and I keep referencing the fact that, you know, COVID is an exfoliant, it exposes. And one of the things that we're doing, we all need to be doing, is really reflecting on what it's exposing. And I think the administration is doing that by trying to leverage these funds to begin to establish that trajectory of addressing the issue at the scale that it needs to be addressed.
And may I add, this is Meryl Gordon. What we have also learned that so many healthcare organizations are going to virtual appointments and virtual conversations with doctors, and the need to have some more than just a telephone. Sometimes the video is crucial in order to be able to determine medical needs. So this is really has exposed the tremendous gaps in the community as well about that access and that needs. So having this additional broadband is so critical as well, and that ability really kind of communicate with healthcare.
Well, I think that's just elevating my point even more that leaving out and segregating a complete different population is not going to CMSD. Makes it that much harder to reach some of the most vulnerable populations that we have. So I certainly would welcome an opportunity as we work with some of our neighboring partners like Cleveland Central Catholic or others that that fill a space that CMSD doesn't. There's no high school in our community.
If I can step in, Director Collier, you can correct me if I'm wrong. And
Sure thing.
And this could be, you know, its own hours-long committee hearing. But in terms of the what we're contributing to for infrastructure, CMSD has a short-term plan which involves distribution of hotspots to their. This area that Digital C identified that they're going to essentially light up was the most populous of CMSD students. But any student, regardless, they don't have to go to CMSD. Any household within this will be able to subscribe to the Digital C plan, similar to what they're doing if Councilwoman Santana's still with us, what they're doing in Ward 14, what they're starting to in Fairfax. So on this 1,000 person, that's just a number of CMSD students that happen to live in this area that Digital C is going to light up. But I would say I'm more than happy to have a follow-up conversation on this topic alone.
Great, thank you. I think that's incredibly helpful. I also wanted to reach out to Director Walker Minor on as we're training outreach workers. She made a comment around a touch point and going out into the community. How are we protecting the workers that are out in the community? I've been out doing, a number of council members have been out passing out food, distributing personal care, but it's been mostly door drop, door hangers, and moving on. What does that outreach look like? Is she still with us? Oh, she's gone.
Oh,
All right.
so because the community engagement healthy home specialists are part of the initiative, I can speak to the fact that the training has been very focused on safe practices in terms of engaging with residents. And it is still meant largely to be social distanced, right? It is meant to be putting door hangers on, talking to somebody from the porch, and then wearing masks. And they are in the process of ensuring that all of the outreach workers have the gear that they need to feel comfortable. But the focus of the training has been, safe public outreach.
So, Director, since you mentioned the healthy homes, are the healthy homes employees are being paid through the city or being paid through the CDC?
So they're still under the contract that they have. It's city dollars, but contracted through the CDC. And we're working right now to see, they're part of the, like everybody, all of us, our jobs have changed pretty drastically to focus on this emergency. So instead of doing a lot of the work they were doing, they're helping with food delivery and the things that we all are doing. They will be part of this outreach probably just when that outreach is happening in their neighborhood, but we're still working through that with Chief Walker Minor.
Well, the reason I raised that is you made a statement, you said a word that triggered as that we're ensuring their safety, but the CDCs have to insure them because it's under their policy. So it's not under the city liability policy. It just raises a question that I'm sure the directors will be asking you about that many times to come. Director Ebersol, I just want to echo Councilman Zone's praise of the department and the responsiveness around the department. One of the questions that's raised is both to Director Ebersol and to Director Maness is a staffing issue. It's hard to get a lot of contract work and signatures in 10 hours a week at City Hall. So I'm not sure, and City Hall, as we all know, that just wasn't prepared. None of us were prepared to be working from our homes the way we are today, and having to rush to City Hall, grab your files, and bring them back to home during that period of time. But how are we managing through the staffing? We have these ideals of putting this money on the street, but being able to actually do the contracts, get them in, and God bless Director Dumas and being able to keep finance working, because again, most of all that's being done at City Hall in 10 hours a week. Is there a system put in place that will help move this along a little quicker?
Director?
So I'll start, I guess. So from a community development standpoint, there are administrative dollars that are part of this plan, and we're looking at what staff we need to add. We will be pulling staff off of some of the work they're doing right now just to review the proposals as they come in, because you can't hire that fast. But we are very challenged because it is also the time of the year where we do our CDC contracts and all of our other nonprofit contracts. But we are also able to augment some of the law and finance staff, and we're looking at that, temporarily to help move contracts. A very important part of this is, though, Assistant Director Wacker said, is that once an agency has a award letter from us, they can begin doing the work. It does mean that they have to carry some of the expenses, but they can begin doing the work. And this whole process has us going more and more digital. So we've been really supported by the IT department to have more of our team be able to work remotely. And we're going to just need to continue to do more and more of that.
Dr. Ebersol, anything?
Yeah, just keep it brief. So been pretty happy with how application reviews and things have gone so far through the remote period. On the contracting side, I think we'll see shortly, but we've done some things to condense documents. I think these are all pretty quick small business loans. We might have to take more of a bank approach, which is, this is the document, you sign it or you don't get the money, as opposed to negotiating out agreements for efficiency's sake. But I think that should work. We try to do some things in program design focus on working capital and things so that we can get money out the door in like one chunk. Like you get 3 months, you pay 3 months rent. That's your documentation. So try to do some efficiency things. The paper, I mean, that's going to be something we're going to have to work through and figure out. I think that, but that's a valid point. I probably could sign 100 loans in 5 hours in a week, right? I mean, but we'll figure it. We'll have to figure that out. But on a lot of the process side, I feel comfortable we're moving in the right direction.
Director, have you looked at some of the programs that the county's implementing where they're working with a third-party agency like Neighborhood Progress, which is implementing their business outreach program, where you would just have a blanket to a third party who then can work with the subrecipients?
We looked at doing some of that because of the way that we're going to be agglomerating all the money. It's not, I think it's easier, ultimately easier for us to issue the paper than to have them, sub-grant it and then we wind up with 100 loan documents either way at the end of the day. Mm-hmm. So I think that works well. But where we have worked and where the neighborhood groups have really stepped up is really supporting us a lot on the marketing and getting the word outside. They've been really pushing real hard and partnered with us over the last few weeks to do webinars and get people out knocking on doors and virtually and getting that stuff.
Yes, and thank you for the work you're doing. And Chairman, I'll just wrap up with a couple quick comments. One, just a reminder, we do have a DPS committee meeting tomorrow at 9:30 to talk about the recycling program. But more importantly, I just want to thank the directors and many of the city staff. We are out picking up trash. I have seen the potholes being filled, the streets being paved. It's great to see the directors here today because the building and housing inspectors are still closing out permits. They're still going out doing citations. The thousands of city staff are out there still working. I think we kind of lose that. And the message of the crisis today is there's a lot of workers that are really rolling up their sleeves and going out there in this crisis. I want to thank the mayor and administration and directors for the great work that they're doing to keep the city running at the level that we need to survive in this crisis. So thank you, Mr. Chairman.
Thank you very much, Councilman. Councilman Blaine Griffin.
Thank you so much, Mr. Chair, and thanks everybody for pulling this meeting together. Just a couple of things. First of all, I want to also commend Director Gordon and her team. They've had the hot corner, and I know that there's been a lot of work that they've had to do, and this has been an evolving situation. So I want to also take time to thank all of the health staff for all of the hard work that they have done through all of this.
We're grateful for that. Thank you so much. I'll share that with the team. Thank you.
Great, thank you. Just a couple of things that I want to double down on, and I know the mayor has been talking a lot about doubling down on health. I really want to get an understanding of how many trackers or tracers we really have with the city of Cleveland if we have another spike, in order to make sure that we have enough of a team to deploy to there. Are we subcontracting? Are we going to use some of this COVID-19 dollars to support subcontracting tracers, or do they work straight for the state of Ohio?
So, Mr. Chairman, to the councilman, thank you for the question. So right now we have been using almost exclusively Cleveland Department of Public Health staff. We have trained cohorts of staff and all of this work is done here on site. The health department is not located at City Hall, so it has been open 7 days a week. We do this operation 7 days a week. And we have also, there have been a few volunteers from Case Western Reserve University School of Medicine and School of Public Health who have helped us, along with some other student interns that we have either had or who have worked with us previously. So we have been handling this. We have upwards of 14 to about 20 people. It can range during the week, and then on the weekends it's a smaller team of folks who are working. So we are making sure that this work is being done here at the health department. as you have heard, the governor has talked about expanding and talking about contact tracers. Again, just for everybody's edification, the work that we are doing right now on COVID-19 is work that the health department does throughout the year for any reportable disease. So it's called contact tracing. It's also called disease detectives. Epidemiology does a lot of this work. Emergency preparedness does a lot of this work. So as you've kind of heard us only sometimes through the process of applying for and accepting grants, this is actually what we do. There's this sort of new terminology all of a sudden, or it's new in the news, of contact tracing and really ramping up this army of folks to do this work. So we are tracing this, or we're tracking this with what the governor has been saying. None of these particular CARE dollars are to go towards that work. We received some additional FEP, Public Health Emergency Preparedness grant dollars to the health department to support this work, as we have kept up with all of these cases, and that has, unfortunately, as everybody here knows, emergencies don't follow an 8 to 5 Monday through Friday schedule. So we are supporting our team through that. But these dollars that we're here to talk about today, these CARE funds, are specifically for what was testified to and spoken about throughout the course of this hearing.
All right, so just so that I can understand, the CARE dollars are not to be used for any back pay or overtime pay or any other operations that were associated with your department. So if I'm understanding correctly, the only dollars that the CARE dollars are basically allocated towards is the HOPWA dollars for AIDS, if I'm correct.
So there are some, yes, Councilman, through the chair. So it's HOPWA. There are additional dollars allocated for HOPWA, and then also the Community Development Block Grant prevention funds that have been there since 1997. Other than that, and those are to support the agencies that help make sure that these services are provided in the community.
And this is just a comment in general. I know that it's time to open up the economy and everybody's ready to get out, but I'm concerned if we have another spike, how do we make sure we respond quickly? How do we make sure that we mitigate the circumstance, very quick, so that we don't have another spike? So it'd be good to really understand at a point in time how testing fits into this. I know it's a national crisis regarding testing, but if we get a spike in Cleveland, it'd be good to understand how man and woman power at the issue in order for it not to be considered a threat that can, threaten the entire city. So I hope we're can take a look at that at some point in time.
Okay.
The only other thing that I have, so President, is I know that you talked about the legal aid, and I think the council president already talked about it. We'll get a hard number, because I have been getting a lot of our assistance, and we are going to get a hard number on who to call directly, because those contracts are not given out yet. Am I correct?
Yes, Councilman, through the chair, if I'm understanding you correctly, you're asking for a number that residents can call, that then they could be referred to legal aid, or a number that legal aid would utilize?
Whoever's going to be the third party contact that's going to handle the rental assistance, we'll have that number in the written briefing, what Council President said earlier, right?
Yes, but Councilman, we will hopefully be issuing RFPs for that work over the next week. And so we won't know who that is, who's actually going to be on board to administer this work, and moving forward till mid-June, probably, almost a month from now, by the time we go through that whole process. So we are going to set up a number within City Hall so that people can begin to, if their inquiries, we can catalog and let our partners know what's coming.
All right. So basically we can expect for those dollars to be released about mid-June for rental assistance, right?
Yes.
Okay. Last but not least, the only thing I'd ask is that we have a couple of business districts as well. So to Councilman McCormick's point, which I'm very intrigued by, if there's a way for us to look at some of the business districts that we have, we can mitigate traffic, other type of things that we could do to increase the opportunity to support those restaurants, because they're also going to go another summer without major events. So for the major event that would happen on Larchmere and Italy, East 93rd, and some of the other business corridors are not going to happen now. And that means that those businesses even need more now because they won't have their big cash cow that they usually have. So hopefully we can benefit from that. I'm looking forward to having that discussion. Thank you, Council President.
Councilman, thank you very much. Councilman Mike Polenzek. I think you have to unmute yourself, Councilman. Councilman? Wait, hang on.
Okay, am I there?
Now you're here, yes.
Okay. I have my technical assistant, my son here, helping me. Question. First of all, I want to thank all my colleagues and everyone for being on the Zoom here. Going back to economic development, just a follow up to get some clarification. If it can be explained, the role of the local development corporations are playing process of a loan.
Sure. So the local development corporations are a valuable resource in helping to connect businesses to our programs. We've done a lot of outreach through the CDC networks. The executive directors, different organizations have put together meetings for their business communities. But as far as actually processing and administering the loans in City Hall, that's all through the department and staff.
Okay, so they have no role in that at this point.
Correct.
Okay, so of the 275 businesses that have applied for assistance, can you indicate each of the businesses in each of our wards?
Yeah, we could follow up on that, whether we want to do it. I could give you 275 today. I could give you, it'll be 300 at the end of the week. So we can just have a conversation about how we want to do that.
I'll let you figure it out how to indicate, because obviously the business that are coming, I am forwarding those economic development to our developer corporation as well to help process. So I'd like to know what success rate we're having and how many businesses and who are they that are applying, because obviously all of us are aware of the crush, the domino effect we're already starting to see in our neighborhoods, with some businesses indicating that they're not going to reopen, that they're done. And so I'm trying to get every business that I can, small business, to apply for assistance. So when you've indicated, so what I just wanted for you to expand upon, I understand the $10,000 program, the $20,000 program. Well, embellish us a little bit more on that one.
Sure. So the $20,000 program is taking what we learned from our first tranche in getting the applications for our emergency initial program, and what we've seen as we've evolved over the last 4 to 6 weeks in where the regulatory orders have been and where the need has been, and really an identification that there are certain types of small businesses that are facing additional challenges, both from forced closure and from going forward, having to really substantially change the way they're going to have to do business now going forward in the next few months. Restaurants are going to have significant capacity constraints for some period of time. They're going to have to invest in a lot more masks and gloves and things like disposable menus and disposable plates. And so those industries, and they happen to overlap, restaurants, personal care, retail. They also happen to overlap with really what makes our commercial corridors strong from a neighborhood building perspective. So those we felt needed some extra help. So this is the second tranche of the program that's going to provide them with some additional capital and make a portion of that forgivable to the extent that they had to make that investment in protective equipment. So another $20,000, $10,000 of that can be forgiven.
Okay, forgiven. And what length of time? What's this term on that?
All of these, the way these loans are getting set up is that there's no payments until next January, and then the payments are for the $10,000 loan, it's $150 a month. So if you get both loans, you'll have a $300 a month payment, and that basically takes you about 6 years to pay off.
And this is, and what you've indicated to us today, Director, and to my colleagues, this is part of the information that we're each going to be provided with, because we've had a lot of information given us today. So I'm hoping that we can get this in writing, especially as it pertains to the loan programs, because that's where I myself am getting the most phone calls about the small business assistance. So I want to make sure that I can get as much information out as possible and help those businesses that are in dire straits. My last comment, my question, and it's been mentioned about the meeting tomorrow at 8:30. I would hope somewhere on the agenda, besides talking about the recycling program, that there would be some comment from the administration, some briefing as to the status of bulk pickup and the problems that we're having with people who are putting out more items adjacent to their bulk carts. It's been a real problem on the east side. Tree lawns just loaded with debris and junk. So I'm hoping in the course of getting an update on the recycling program that we can also be briefed on this. It's become a major source of complaints in my own community, and I'm hearing it from my other colleagues, specifically my east side colleagues. So I'm hoping that would take place as well. My last comment is to Director Gordon in question. You've indicated, as it pertains to someone who is feeling ill, has the symptoms, they don't know for sure, that they have to sit at home and do what they have to do to try to get over it, or at some point obviously call a doctor. I'm told right now on the northeast side, please correct me if I'm wrong, if someone is ill and they really feel they have it, they cannot go to, let's say, Euclid General Hospital. They just can't go there. That they're only accepting right now first responders. If first responders feel ill, they can go right to the hospital and get checked. What is the protocol on the hospitals?
So, Mr. Chairman, to the councilman, each hospital has telephone numbers that anybody who is feeling unwell, same with any of the FQHCs, there's so much that they're all doing via phone, so you can call in about any symptoms that you have. There's a Dr. COVID line at Metro, but just to protect everyone, all the hospitals very early on did request that you not just show up at the hospital. This protects everybody. So each one has their own policy. I don't know for sure exactly what Euclid Hospital is or isn't saying, or who is permitted. Certainly if somebody needs EMS services, they must call 911. Please do so. That is what it's there for. They've all been keeping up with all of the guidance of what to do for EMS or for emergency situations. But if somebody feels unwell, they should certainly reach out to a doctor. Can do it again at Neon, at Care Alliance, at Metro, at Cleveland Clinic, at UH, at St. Vincent, and they will certainly direct those individuals what to do.
Okay, thank you. Thank you very much for that information. And again, I'll look forward to receiving anything we can in writing, updates. It's very important. So I'm sending that out, disseminating that to my community as best as I can. So anything you can regardless of what the VIN is going to be very helpful at this point. Thank you very much. I have no further questions.
Thank you, Councilman Plenzik. Councilman Brian Casey.
How do I get off of this?
Are you muted? Okay, there you go, Brian.
Can you hear me? All right. Thank you, Mr. Chairman. Just to reiterate a little bit on what Councilman Brancatelli had touched on in regards to the students for Director Collier. You said that there was 500,000 going that would basically affect the 1,000 CMSD students. Is this set up in their individual homes, or is this like a hotspot area, much like Ward 13 is set up? We've got hotspots around the neighborhoods. How is that set up?
So Director Collier, can I take this real quick? Because I just talked to Eric Gordon about this on a daily basis.
That's fine. I'll chime in, yes, sir.
Yeah, chime in if I make a mistake. The school district has set up a short-term solution for its students that they've identified with needs. They send them home with a hotspot that's it's basically a phone that's been repurposed by an organization called PCs for People. They're going to use it as basically like on your phone has a hotspot, and Sprint is going to provide the service. So through this hotspot distribution, all of the CMSD students will have a short-term solution that will last 12 months. The program that we are contributing to is it's a neighborhood-based program similar to Ward 13. And it's going to be launched in the area that is most heavily populated with CMSD students. But that won't be like a hotspot. That'll be like a neighborhood-based Wi-Fi program with line of sight and access to the home. Is that accurate, Director?
That's correct. And again, our resources are three-pronged with respect to helping to build out that infrastructure. So it's the infrastructure or vertical infrastructure, because you need to have a tall building to broadcast the signal from. Then there is the attachments to the individual properties. And then there's the devices internally to the properties. So that's how our resources will be divvied up to support that 1,000 student footprint.
And then, Mr. President, to Director Collier, or to Mr. President, if you know yourself, have those 1,000 kids been selected yet? And do we know where they are in the city?
Yes. And it is going to be a neighborhood-based program. Everybody who's in Ward 16, all the CMSD students are going to be served by the hotspot distribution, as opposed to this infrastructure. The infrastructure is, Director, you can tell me the exact coordinates of it best you can, but it's not in Ward 16, but the CMSD students will get hotspot access. Director?
Yes. So one of the key things is that it has to be in a digital C service footprint. So near West Side, you have Glenville, and you have some other areas, and we have a map that we can show you that shows how CMSD students are distributed in relation to the actual service area footprint that Digital C has at this current juncture. Again, Digital C is scaling up, the district is scaling up, and everyone's scaling up to meet the broader need. And there's a number of different approaches. The council president just alluded to one of those approaches, which is the hotspot. But everyone understands that there's a need to address the larger issue, and that's what we're building up.
All right, it's Mr. President, to Director, it looks like this is probably a lot further along than what we probably thought it was, with things that have already been selected. Is there any way that you can just, in an email or something, share to each council person individually how their neighborhoods are going to be affected with this, or how they're going to make sure that it's covered?
Sure, we can send you the information from the CMSD with respect to their concentration of students.
Okay,
because that's really, keep in mind, it's more focused on the students. The only geographic consideration is where the Digital C footprints are, but the focus is on students, and you can see, you'll be able to see the saturation of students in those geographies.
And just to follow up on that real quick, when it comes to the hotspot areas, are those hotspot areas just for CMSD students, or can they be used by any kid or any student from another charter school or private school, will they have access to that as well?
My understanding is that these are specific for CMSD students who have been identified as not having reliable internet connection.
Okay.
So as far as the internet in Catholic schools, they are not part of that.
Okay. And then my second question is for Director Donald. I was just wondering if the rental assistance, and I know we're calling it rental assistance, we have a lot of individuals in the city of Cleveland who are low income who actually have mortgages as well. So is this just going for rental assistance, or could it help low income individuals who have mortgages?
Through the chairman to the councilman, this program here is mainly only for rental assistance. And for a couple of different reasons, as we look to see what were the pressing and immediate needs of the community, as the evictions will start up shortly. Most mortgage lenders have some type of extension as far as filing foreclosures or issuing some type of forbearance. So in the first tranche of money, we are mainly focused on rental assistance. We will and are keeping our options open as far as foreclosure prevention, et cetera, moving in the future. But we didn't feel that that need was one that was going to happen in the next 1 or 2 months with foreclosure. But as far as evictions, it will.
And I know we'll be able to follow the evictions, but do we have anybody specific, or are we using ESOP or anybody to monitor the people who are getting behind in mortgages?
Well, currently the county, of course, is funding several different foreclosure counseling agencies, et cetera. And so several of us are on different committees, et cetera, that talks about this very thing, that are monitoring it. So, and Director Ness, you can correct me if I'm wrong or have anything more information to provide. But yes, there are organizations out there, as I've been on several phone calls, that are talking about this, but not necessarily as part of this funding situation now.
And I think the only thing I'd add is that we are, through our banking relations manager, talking to our local banks as well as some of the national banks that bank locally here, and really encouraging that after the 3 months of forbearance, that they are not requiring balloon payments. It looks like most banks are looking at extending people's loan period so as not to force or essentially cause foreclosure right after giving that grace period. So we'll be monitoring that closely.
All right, and then Council President, what was, I'm sure that somebody had mentioned it at the beginning, but what was the total amount of money that the city received for the CARES Act?
$19 million.
And does anybody know if there's any talk of a second round?
I don't, I mean, I'm sure there's always talk, but I would kick that to those administrations that are following this more closely than I am.
Okay.
Director Ripka, or Chief Ripka, do you have any insight on that?
Let me refer that to Assistant Director Wackers.
Assistant Director?
Yeah. So in the CARES Act, there was 2 tranches of money that are going to funnel into our entitlement program, CDBG, ESG, and HOPWA. So the first tranche was required to be just announced 30 days after the passage, and the second tranche
that we're contemplating that are queued up.
Yeah, these are authorized by Congress already.
Right. Is there any more than what's been authorized by Congress that's in the discussion phase?
Well, we still be notified about our second tranche, and then there's been talk about doing something with home funding, but that's, I haven't seen anything that's even drafted yet.
Just on this point, Mr. Chairman.
Councilman Casey, if you'll yield to Councilman Zone.
I yield.
On this point.
Thank you, Mr. Chairman. Thank you, Councilman Casey. Just to my colleagues, right now, Congress is looking and they're asking the House to take the lead. So Speaker Pelosi's team is drafting legislation. I've been sending information to the administration around what they're calling the Relief Act 4.0 that will send direct funding to local governments and particularly cities under the size of 500,000. That's why we didn't get direct funding last time. So there may be a need in the short term at some point, Mr. Chairman, for us to do a resolution of support. But I've been forwarding all of that to Chief Dumas and Chief McCall.
Great, thank you. Thanks,
All right.
Councilman.
Thank you, Mr. President.
Thank you, Councilman Joe Jones.
All right, can you hear me okay?
Yep.
All right, great. I think my colleagues really touched upon some really good topic matter. One of the concerns that I have, and this first initial question will be directed to Mr. Ebersol. The programs that are now available, I know that there is, one loan program. How many programs do you have available for small businesses? And what are they? I know I've heard some of it. The reason why I'm asking, because I've been getting a lot out there on as relates to calls coming into our office concerning small businesses, and who are the contact people that and phone numbers that can be contacted to direct them to your office.
We have been over that, but I'm going to ask the director to answer that as briefly as you can. If you can restate the answer that you gave me.
We're outlining 3 programs through this recovery plan: emergency working capital program, which provides $10,000 loans to all types of small businesses; a second tranche of that program that provides up to $20,000, $10,000 forgivable to certain sectors, which we'll be rolling out soon; and then a third program that provides working capital support more broadly on a larger scale to businesses of a little bit more size, which we'll also be rolling out. For contact, again, you can send people to me, you can send people to anybody on my staff, and we'll help them get the application.
Is there a phone number I can give them direct?
Yeah, I mean, 216-664-2204 is my number.
2204, so send them directly to you?
Yep, that's fine.
And the director said they're going to provide in a written document all the contact people for all the various programs. Councilman?
Okay, and also, I just, this one here is with the CMSD. I just think that that's outstanding. And that we got these hot, I presume they're hot phone devices. They're going to be given to each of the students, and then there's the zones. I don't know. Can you clarify what that zone? I know you were saying something about the zones, but I wasn't for sure. Is it like an area where you're going to have like broadband based, like a signal in the area where you can like loop it into your computer or something like that? Or is it all telephone technology?
No, it's Director Collier, if you can take this best you can.
Mm-hmm. Sure. So the infrastructure associated with the delivery of the broadband service is based on the actual household itself. So the infrastructure necessary, and I'm visual, I wish I could have provided a visual graphic for you. There is a apparatus that goes onto the properties that actually captures the broadband signal. And you have to also identify vertical structures within a certain geography that's the capture for the actual signal. And then there's the need internally to the household for the student to be able to have a device. As the council president alluded to, the hotspot is sort of the quick temporary solution that's going to provide it. Part of what we have to begin to think about is beyond that, how can we begin to stabilize and establish ourselves with the digital infrastructure necessary so we're not ever caught flat-footed again?
Does that answer your question, Councilman?
Yeah, it does. And
I'd be happy to talk to you more about this. I've got a bunch of maps and stuff I can show you as well.
Sure.
Thank you, Council President. Yeah, it does. It just to touch on it, it's just really good to know that we are providing something that's going to help our students. So kudos to the administration on being able to put some of that together. And then finally, on that issue, how much is it going to cost us?
So our initial, I'm sorry, go ahead.
We're contributing $500,000.
As a city to CMSD on the issue?
Not to CMSD, but to the Digital C part of it. Is that correct?
Well, it's through CMSD. So we're hoping to contribute to advancing that program and that relationship with Digital C, the city, and CMSD.
Okay, great. And then the next issue is dealing, we know that, and I've been saying it for the longest, some of you guys probably remember early on me texting in March about how significant this virus is. And it is my understanding right now that there is a second virus raising its head that is looking to attack young people, or have started to do that in New York. Which raises a really concern for me and a concern for our city. And I know I've said at a number of meetings and with the police department, health department, and all of our big top shots and big guns in terms of being prepared for these kind of attacks as a city, viral attacks. And we got it, we're right in the middle of it. So the issue is, what are we doing and how are we preparing ourselves for the complexity of a possible new emergence of another virus, in addition to the virus that we already have? I know that the director has talked about Rite Aid being among some of the locations for testing. As most of you are aware, our federal government is leaderless on this. And we are just, bumbling around in the dark as a country when we should be in a position of leadership on it. So the issue would be this, in terms of us sitting here as a majority on this issue, are we looking at any possibilities long-term or short-term in terms of really getting a handle on testing and maybe even taking some leadership initiatives on the issue? One, in terms of making sure our population is protected. And then two, are we looking at any kinds of ways or setting up type of systems with the healthcare professionals that we have here for some kind of tracing program that will begin the possibilities of really getting into the what needs to be done, like other cities and nations are doing? Are we studying that? Are we pushing those initiatives? I don't know what we're doing, since I got the director here. This is a major issue. It's critical, and we really need to be doing something. We need to be taking the lead on it.
Okay, Director Gordon, I know you've hit this a couple times. If you could summarize what you said and answer the councilman's questions.
Sure. Thank you, Mr. Chairman, council members. So again, this is the work that health departments do, is contact tracing, disease detection, and making sure that we are able to contain and mitigate infectious and communicable diseases. So we are doing a tremendous amount, from educating the community to working with all of our COVID positives, all of their families, all of their contacts, close and not so close, their employers, and anywhere that they might have been that they could have infected somebody. So that work is happening all day, every day, 7 days a week. The thing that you also mentioned, there are, we're trying
on that point, on that point, Director, do we have like a system in place that's tracing these issues? Do we have like a team of folks that are doing that?
Yes, Mr. Chairman, through the chair, yes, we do. We have a pretty extensive team here at the health department that is doing this, again, all day, every day. So for every case, I know right now we're at above 950, I believe, but for every single one of those confirmed positives, we have interviewed an average of 3 to 5, it can be upwards of 20 people, depending on how many people they were around. And we have talked to each one of those close contacts to determine the risk of them in the community. So yes, that work is done all day, every day.
Well, that's excellent. I didn't know that. So we do have a team of expert professionals on there tracing this down and tracking it down,
yes,
and figuring out where it needs to go. All right, that's excellent. And then secondary, you can go ahead and continue. I'm sorry if I thrown you off, if you remember where you were at in your place.
The only other thing I was going to say is you did mention that we are aware, we're trying to follow the science of these different strains and different ways that this pathogen actually metastasizes in the human host. And so it's really been something that is, the world is watching. So it is is something that we are kind of keenly aware of here, and that's why we work so closely with hospitals and healthcare organizations and the Ohio Department of Health to make sure that we can track and follow all of this in ways that protect the community and protect individuals and residents.
With this disease, director, that is impacting the whole entire planet, of course. You know, the director has the governor, and this thing called the president wants to open up the entire country. Are we prepared to deal with an increase in this virus based upon not being prepared on a federal level? We don't have, as you stated earlier, enough testing. We don't have any leadership that we can really fundamentally follow on a federal level. As many of you know, this president is just bumbling and hitting the walls all over the place. So how do we handle this when it opens up in the Cleveland area? And a lot of talk has been that it's going to be more unfortunate, victims of this because of the simple fact that we're just simply not prepared. So what are we doing to prepare ourselves as a city when we do eventually open up full throttle?
Sure. So, Mr. Chairman, to the councilman, like we've said so many times here, there are a number of ways that we are educating and informing the community. I think that the governor and the Ohio Department of Health, our partners in this work, have done a real tremendous job at making sure that people are aware. We do as well. All the local health departments do. Things are opening very slowly. We are making sure with the mayor's outreach initiative that we are reaching people in communities and trying to make sure that all vulnerable populations are aware, to the extent that we possibly can, every way that they can protect themselves. Masking, washing hands frequently, sanitizing frequently touched surfaces. So a lot of this work has been done. We aren't kind of pointing fingers at any one particular person, and it really is a waste of energy to do so. So we are really all in, and I think that what City Council has done to, as a resident of Cleveland, I get your newsletters. We're helping hopefully with the next one to give even more information for the community. And so this is an all-in effort to make sure that everybody knows what they can do to protect themselves.
Now, finally, the last question, Director, is in our community, how can you tell? I know that I'd heard some of the talk about the 44128, the southeast section of the city of Cleveland, and I've been getting calls on this about to respond and how to act to it, but I don't know. How impacted is the virus in the 44128 southeast section of the city of Cleveland? Because I don't have those stats.
Sure. I hope that all of the members of council are able to take a look at our website, where we have a dashboard, and that dashboard is updated daily, and it is as current as possibly can be of all cases. It's interactive. If you look at the chart next to the map that has all the zip codes, you can see sort of where that is in terms of zip codes and prevalence of confirmed cases per zip code. Right next to the map are some charts, and you can flip through. That includes demographic information and et cetera. So there's a lot of information there. But as these cases increase, they're going to be more.
So Director, they're going to be cut to the chase. The zip code information is on the website.
Thank you. Sorry, clevelandhealth.org. Yes, clevelandhealth.org.
Thank you.
Cut to the chase. Thank you.
Well, thank you, Mr. President, and thank you for making sure that you got those newsletters out. That had made a very positive and profound impact. So, I appreciate it.
Thank you. Last and certainly not least, Councilwoman Phyllis Cleveland. Oh, wait. Then we have one more after Phyllis. Councilwoman?
All right, thank you. Thank you, Mr. President. Most of my questions have been answered, but just a couple of things that are on my mind. And I think this is a great collaboration between departments, but I noticed that aging is not a part of this. And, our most vulnerable population throughout all of this pandemic are our seniors. And so I just want to raise that and say, let's not forget about them. Yes, Director.
Yeah. Councilwoman Cleveland, I just wanted to say we couldn't have survived through these last few months without Director McNamara. She has been involved with all things related to this response, at least from the health department perspective. And I know with a lot of this discussion regarding the CARES Act funding, but you're right, she is not on today, but I just want to give a huge shout out. She has just been a tremendous resource and rock and support. And she and her team are doing outbound calls to seniors every day, checking in on the homebound and making sure as they need resources to match, or if they have needs, that we can match resources to them. So I appreciate you bringing that up. I'll turn it over to Director Maness.
Yes, and thank you. So Director McNamara has informed our planning for the CARES Act funding, and specifically as we looked at the need for food delivery, she really helped highlight that need. And so the basic needs, $4.25 million, we will be getting proposals for work that will be focused on aging, and we'll ask Director McNamara's team to review those proposals and help us select those.
Okay, that's good to hear. And yeah, big kudos to Director McNamara. I know just in terms of the working with the food bank and the food distributions every week at Community Lot, as well as throughout our city, they've really been filling a need for seniors and others in our community. Another concern I have, our numbers compared to similar cities are not bad, and that's not to say that any death or any sickness is acceptable or okay, but we know it's going to happen. But when we look at Chicago and Detroit and similar cities like ours with similar populations, our numbers are pretty contained. And just from my personal belief is that at some point we're going to get hit, and one of those reasons is we still have a lot of people who are not complying with social distancing, staying at home, what have you. We're always hearing about parties going on and a lot of people congregating in certain areas. And so I'm just wondering, with the outreach workers that that we have who will be going out, it's one thing going door to door, and the people you find at home are the people who are complying, but is there thought given to sending people to where people congregate and to places where they're really going to reach people who need to be reached and who really need to be, encouraged and strongly urged that they need to comply? Because ultimately, I just know of a situation over the weekend where a person in my community, an elder, was infected, and she was infected by her granddaughter who goes to a lot of parties. So, my hope is just that with the outreach workers, that there's going to be a real focus on the non-compliant parts of our population. Thank you.
Thank you. Thank you, Councilwoman. We have one more person for questions. There's no name associated, but I can tell by the shadow that he's either a Green Bay Packers fan or a University of Georgia fan. But I believe that would be Kevin Conwell.
Can you hear me?
Yep.
Well, this is Mighty Mighty Top Letter is Blazer on. I was out in the community where I didn't get a chance to
I know that
to do the walking. Dealing with we're tagging on with Councilwoman Phyllis Cleveland's talking about, Mr. President. I have to go out personally in my neighborhood. I have a lot of parties just going on, whereas they're charging people to come into their homes. Cars are parking up side by side on streets like Massey, Parkwood Drive, as well as some of my other streets. And on Friday nights or Saturday nights or Sunday nights, when they're having house parties, and it's out of control in my neighborhood. I called the police today, and I plan to go out Monday to talk with the residents to do knock and talk. I need the police to be more diligent on this matter to break these things up. But the councilmen, they call us, and we have to go out to deal with these house parties. And I need your help, Mr. President, to reach out to the safety director so that they can do some prevention.
Definitely. I'll be, I've got a couple things to catch up with him, but I'll definitely put this on the list.
Yeah, so I know where the streets are at. I'm going out Monday to deal with that. Here's the other thing, with Code Red and Cleveland Care Calls. I think that we need to reach out to the seniors more so that they have notification, so we can let them know what's going on, COVID-19 or with any kind of virus. They need information. So I know you talk with the Department of Aging already. So we need some kind of way that we can notify our residents instead of not just with the newsletters, but moments notice that we can reach out and reverse 911, calling our residents. I think communication needs stronger. I think the Cleveland Care Calls need stronger also.
Okay.
The other thing that I'm looking at dealing with COVID-19, I've created some legislation dealing with these gas pumps. We don't talk about that, but thousands of cars visit gas stations every day. And you pull these gas pumps out, and the gas pumps are filthy, they're nasty. It's the health departments need to regulate them by putting dispensaries there dealing with hand sanitizers. The Kevin Kelly, you and your family, my family, Phyllis Cleveland family, they have a right to be able to sanitize before they get into their cars. These gas pumps, we're not talking about that, but they carry serious disease and bacteria. So the health department, I need your help with that. I'm going to see some legislation. Remember, I was talking about the legislation, but I need them to start looking at these gas pumps.
Yeah, understood. That's a good
When you
point.
stop with your family, right? When you stop with your family, if Kevin Conwell's there and I have, let's say I have COVID-19, God forbid I don't have it, and I touch the pump, you come and you touch the pump and you contaminate, it carries diseases.
The surface
So
like
we
any
definitely
other.
need to have hand sanitizers there.
Yeah.
Pardon me?
Yeah, it's a surface like any other. I
And that's
agree.
all. Right. I reached out to the governor as well about that, and he agreed. And my wife is pushing legislation in the county, and they're there also. And the other thing is these keypads. When you go and you punch the keypad, say at our ATM machines, they need to be constantly wiped out, and we need to monitor that because someone could come behind Kevin Kelly, have bacteria, or even the COVID-19 virus. You touch it, you touch your face, you touch your eyes and hands, and you can contaminate things. So we got to look at more preventions and a way to have prevention.
Yeah, I agree, Councilman. Look, if you have if you got some policy draft, if you can get that to me and we can start moving on, I'd appreciate it.
And could I give a copy of it
please.
to the health director, because I need their help on it.
We'll pass it around and we'll come up with something.
Honestly, matter of fact, I am excited about it, Mr. President. Richmond Heights have reached out to me. The city of Akron actually forwarded over to them as well. Russell, the council member over at Akron, Russell, I forgot his last name. He wants to introduce it as well. You know, a lot of people travel through and they stop and they, got gas, and you could contaminate your whole car with that.
Yep, understood.
So I'll give you the legislation tomorrow.
Okay, looking forward to it, Councilman.
Thank you.
All right, thank you.
All right, thank you very much. Goodbye.
All right, take care,
All right.
Councilman Conwell. Want to thank everybody.
All right, take care.
Thank the administration. And as a follow-up item, the quicker you can get the executive summaries with phone numbers, with description of how these funds are going to be spent and how we direct people to use them would be most appreciated. If there's nothing else for the good of the order, we're going to adjourn. I will see some of you tomorrow at 9:30. Unless there's something further, I want to thank everybody for your patience and participation, and I'll talk to most of you tomorrow. Thanks so much.
Thank you, Council President.
Thank you. I'll unmute everybody. All right, take care, everybody.
All right, thank you, Mr. President. See you tomorrow.
See you tomorrow.
Suit and tie.
Thanks to the clerk, everybody who helped me kind of host this. Thanks a lot.
Thank you.